Bad news, my friend. The company has been forced to take some budget cuts, and with that, we've needed to sell our top quality equipment. But fear not, they knew that my patient, that's you, they knew that my patient today was very important, and so they've issued me a spare that will work just as well. Okay, it'll help us just as well. And of course, if anything, I'd say this is better because it's all nice and colourful. So we have all sorts to work with here today. So they've been kind enough to even issue me a little clipboard that's just around, not even as big as my head. Very adorable. So I think we should just start off with just taking your name. Okay, and then can you also tell me your gender? Good. Can you tell me your age? I could have sworn you were much younger, but okay. Nah. Usually that would be it, but there's a couple of extras here. Do you know your blood pressure? I'm thinking that doesn't make much sense because we'll be taking care of that today, okay? Do you know your body temperature? Let's be honest, who does these days? Do you know your heart rate? Can I just have a listen? No, of course not. The last one here, it says any remarks. Do you have any remarks for me or anyone in the building? Anything you'd want to say? Oh wow, okay, I will let them know. I can see you're a fiery type, alright. Okay, perfect. So, I think we should start off with just checking your heart rate, seeing how everything is doing. Got my lovely little stethoscope here. Clearly made for my head. Nice and small enough. So, the special thing about this one is it also comes with a sound. Isn't that fun? So we're going to test that. And of course, I would assume that if you have a heart, it will go off. And if you don't, well, that's not my jurisdiction. So anyways, okay, so we'll just put on this side. So if you could just breathe in for me. Take a deep breath. And then breathe out. Okay, and then on this side, can you just breathe in for me? And then can you breathe out? Okay, well, maybe you might have... Did you know that you might have two hearts? How fun. Okay, and then we'll just go along the back here. So if you could just breathe in for me. And then can you breathe out? Okay, and then can you just... We'll do the back on the other side. Can you just breathe in for me? And then can you breathe out? Interesting. So your heart or hearts are working. The fact that I heard that special sound on the front and the back 4 times makes me wonder that you may have 4 hearts. Congratulations. I'm sure we'll have fun taking care of that on another date, but first, now we're going to take your blood pressure. So if we can just... You could just hold out your arm for me. Got a special little one here. This nice little happy meter. Okay, so let's just put that on there. Just wrap it around here. Just test it. Test the dial. Okay, perfect. So let's... Oh, a bit finicky. Okay. Okay, looks like the happiness dial is quite high. Good to know. But just want to check on this side as well. So just hold out your arm for me. Just wrap it around here, and then we'll just do the same again. Good. Let's keep going. Well, isn't that adorable? Look at that. You're all nice and happy there. How sweet. Okay. And then next, I want to take your pulse. So, I want you just to put your finger just in there for me. Thank you. Let's just put in some coordinates here. Okay. There's no beeping for this one. Just a little click. Okay. Perfect. A very healthy temperature. Very nice. Okay, so I think then we should just move on to your eyes first. Just going to look into this box here. Perfect. So we'll just keep it simple. It's got a nice little light here, so I just want you to follow this. I've noticed that it tends to blend into my gloves, but just focus on where the light is going here. Okay. Is that comfortable? Is there any pain with needing to try and follow this light? Okay, but just in case, can you just blink for me? Just blink. Okay. Now I'll just keep following the light. Okay, and would you say it's more comfortable when it's closer or when it's further away? Okay, and then if I pull it back here, does your eyes strain when it's trying to follow it? Okay. And then can you just tell me, is the light on or off? Okay. Is it on or off? Is it on or is it off? Are you sure? Okay. And then is it on or off? Okay, and then can you just tell me when you see the light again, just keep following it. Actually, no, let's change it up. I want you to focus on my nose. We'll do the same game. So we'll just focus on my nose, and I want you to tell me when you see the light. Good, good. Excellent, keep going. Keep focusing on my nose. Excellent, doing very well. One more time. Excellent. So, focus on the light again. Now, can you tell me, does this, the way this is moving, would you say this is faster or is it slower? And is this moving along the bottom of the vision, of your vision, or is it moving along the top? Okay, and then can you just focus on my forehead for me? Is this on the left or the right side? Okay, and again, left or right side? Okay, now just keep focusing on my forehead and tell me, is this slower or is it faster? Okay, and then would you say now it's slowed down even more or sped up? Okay, and then can you focus on my chin? Is this more above or below? Okay, and then what about now? Is it more above or below? And is it further away from my head or closer toward my head? Okay, and then on this side, is it closer to my head or further away? Okay, well done. You can blink again, just blink, blink, excellent. So now then, so just curiosity's sake, would you say you've been rather stressed lately? Well, I just so happen to have a trusty pair of scissors here, so I just want to snip a few of these stressful strings that I'm noticing here. So if you could just take a deep breath in for me, and then breathe out. just feel free to just close your eyes. I'm actually going to just pull off a few here. You just take another deep breath in for me. And then breathe out. Excellent, thank you. And while we're at it, I think we can also move on to your ears as well. So can you just, if you've been closing your eyes, can you just keep them closed for me? Can you tell me when you hear a snipping, doesn't matter on which side, just let me know when you hear it, okay? Mm-hmm. Mm-hmm. Yes. Keep going. Doing very well. Okay, and then next, I want you to tell me, keep those eyes closed. Just let me know. Do you hear my gloves or the scissors? So keep those eyes closed. Mm-hmm. Yes. Mm-hmm. Mm-hmm. Keep going. Doing very well. Mm-hmm. Okay. And then can you tell me, do you hear any sound on the left or the right? So it could be the scissors, or it could be the gloves, or whatever else, alright? So left or right. Mm-hmm. Mm-hmm. Again, don't need to tell me what the sound is, you just need to tell me if it's on the left or the right. Mm-hmm. 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 Okay, that'll do. Very well done. Just got one more for you. Going back to the stethoscope, we're just going to go back to the low sound here. I want you to tell me how many times you hear the beep. So that would be 2. That would be 3. So keep those eyes closed. How many? Mm-hmm. Hopefully it's not scaring you. And yes, 1. Well done. Mm-hmm. Mm-hmm. Okay, don't want to scare you or make you jump, so we'll stop that. Now I want you to tell me, is this closer to your ears or further away? Don't worry, I'm not going to put it directly at the ear, should be fine. Okay, I'm worried it's going to make you jump, so I'm not going to do any more. Okay, and then next, I just want to test your reflexes. Well, I think I finally figured out what this thing is actually for, so I just want to check on your forehead, your chin, your cheek, your other cheek. You just hold out your arms for me. We're just going to test your elbow. And on this side. And then I'm just going to go a bit lower, check your knees. Try not to kick me. Okay. Okay, excellent. And then I would just like to check your mouth for a second. Just see how things are. So just let me find the light again. Where is it? Ah, there we go. So, just a quick question. Have you been to the dentist recently? Did you happen to give a certain someone your teeth? Did you get them back? Misplaced? Well, fear not, because apparently the guys at the office thought about this because they happened to give me a spare pair of teeth just for you as well. So, just gonna put that in there. It's your choice if you want to just keep these or just want to use them as a spare for now. So just tighten that in there. Is that okay? Okay. And then just want to just have a look. See here. Okay. Looks like we've been keeping these teeth relatively clean. I'm not seeing a speck on them. Let's just have a good count. Go 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19. Okay, and then what about on the bottom? We've got 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15. Okay, teeth are all accounted for. So let me just chip it a little bit. Ugh. And then I'll also give you a free brushing as well. I am also a dentist on the side, not the one you've seen. Not at all. No. Okay, so let's just have a quick brushing here. Actually, we may need to be quick because just going to break the fourth wall for a second. My phone is on 5% battery. So yeah, we're going to have to be quick. Yep, okay, that's just fine. Let's just do a little bit of chipping here. That is delightful. Apologies for that. Yep, and then let me just check with my fingers here. How are we feeling? Yep, just don't worry, your teeth can handle it. No worries at all. That's perfect. Right, and then just got a special little light here again. Let's just have a feel around. All looking spiffy. Yes, whoever that dentist was did a fine job. Okay, my friend, we are done. I'll just take those back. Thank you very much. I'm sure you'll be fine. Don't worry. But yes, looks like the power is low. As I said before, 5% battery. That totally was not me breaking the fourth wall in a panic. But you're doing great. You look great. You sound great. And if you have any issues at all in the future, tomorrow, whenever, then by all means you can come back and see me. But until then, take care, my friend. And watch your step. It's a bit dark. Bye.